Hi, I'm Mike Hudson, Director of the Museum of the American Printing House for the Blind. Welcome to the Redux presentation of sessions from the Hidden Legacies of Helen Keller Symposium, which was held in Louisville, Kentucky on September 17th and 18th, 2022. The symposium, with primary sponsorship from the American Printing House for the Blind and the Filson Historical Society, brought together scholars, writers, and Keller enthusiasts from across North America. In 2020, the American Foundation for the Blind Helen Keller Archive arrived at our museum on 23 pallets. And since then, our staff has been busy cataloging, describing, measuring, and inventorying this most amazing history of one of the most amazing women of the 19th and 20th centuries. I'm sitting in front of her desk from her house at Arcan Ridge. Helen Keller was a writer, activist, advocate, ambassador, and world traveler who profoundly affected the way the world thinks about people with disabilities. And yet, she is little understood, often frozen in time as a little girl with her hand under the water pump behind her parents' home in Tuscumbia, Alabama. Our symposium was just a beginning effort to bring together the most current scholarship in innovative ways to better understand Keller, her companion Anne Sullivan, and her times. We hope you enjoy the series. Each session will be dedicated to a single speaker from the symposium. Our third session, on Saturday afternoon, was titled Tracing Evidence, Picturing Keller, Reproductive Advocacy, and Eugenics in the Progressive Era. The panel used film clips from multiple genres of silent film footage produced in the Progressive Era to explore how the U.S. public imagination was persuaded, or not, about different issues and values in public health, eugenics, reproductive control, and policy. The first presenter in that session was Dr. Janet Golden, Professor Emerita of History at Rutgers University. Dr. Golden spoke about eugenics, immigration, birth control, and blindness prevention associated with sexually transmitted diseases, all topics Keller engaged in. Dr. Golden specializes in the history of medicine, history of childhood, women's history, and American social history. She's the author or editor of numerous books, including Babies Made Us Modern, How Infants Brought American into the 20th Century from Cambridge University Press, and Message in a Bottle, The Making of Fetal Alcohol Syndrome from Harvard University Press.
So I'm going to ask some questions, answer some questions about the political and the public health environment that shaped the career and beliefs of Helen Keller and that came to be reflected in eugenics and related films that we will see. I'm going to talk about Helen Keller's work along with others in promoting prophylaxis to prevent gonorrhea, ophthalmia, newborn, when gonorrhea was transmitted at birth from mother to baby as the baby passed through the birth canal. And it was one of the most common causes of blindness. So in short, I'm going to show two sides of Helen Keller. The one that for a short time got swept up in false, racist, and nativist pseudoscience of eugenics, and one that became an activist for a key public health program protecting the vision of millions of babies, and how these activities both reflected the cultural and intellectual life of what we call the Progressive Era, which is roughly the years from 1890 to 1920, in which many social and political movements worked to, quote, improve, end quote, American society. So let's start with the big picture. What is eugenics? Why did it so enrapture Helen Keller for a time? Simple definition. Eugenics is the belief that a quest for human betterment can be done through better breeding. It is founded on a belief in heredity, that what we inherit from our parents determines what we might call social traits. So, shorthand, people would say biology is destiny. And thus, through social engineering, the control of reproduction, eugenicists aim to improve society. There are two core beliefs there. One is that degenerate parents drunkards, criminals, tuberculars, syphilitics, sexually promiscuous, etc., are giving birth to children that reflect those traits, and they're breeding in dangerously large numbers. This is an image of people, hired people dressed up in tattered suits, all men, and they have signs in front of them that say that they're carrying, "I must drink alcohol to sustain life. Shall I transfer the craving to others? Would the prisons, asylums be filled if my kind had no children? I cannot read this sign. By what right have I children?" And it's a eugenics demonstration on Wall Street in 1915. A second assumption of eugenics is that the distribution of traits was uneven between human races, with some groups burdened with so-called inferior traits and others better endowed with healthy traits. So eugenics didn't sort people into categories. Those categorizations themselves by race, gender, class already existed. What eugenics did was to harden those categories by adding a varnish of science. And note, by using the term race, eugenicists were not referring to African Americans and Euro-Americans as two races, but they saw many races. So people from Poland would be one race, people from Slavic countries, another race, people from Southern Europe, the Italian race, the Greek race, etc. And of course, Jews, Muslims, and Catholics, people from Central America, Mexico, those were other groups of undesirables, different races with inferior racial characteristics. And ironically, there, of course, were eugenicists who were members of these groups. So eugenicists supported the reproduction of eugenically superior individuals and feared that white Protestant Americans were facing race suicide. They made what were called eugenic marriages. Oh, I went in the wrong way. But they don't breed as they should. So let's roll a bit of a film mocking this from the Edison Studios silent film of 1904 comedy Anti-Race Suicide. And what you will see is a businessman rushes home. We don't get that one? Didn't get that one. Okay, well, I'll tell you about it. Businessman rushes home after getting word that his wife is about to give birth, and a servant brings him a bundled baby who's then weighed by the nurse, followed by another baby, followed by another baby, until there are 4 babies, and the father seems to faint and to be revived by the doctor. So it kind of suggests that these well-off white families don't want to have large families, and of course, popular culture was part of that debate. All right, let me get to my next pages here. And then, of course, there is fears about race suicide, as I've said. One of this is addressed in the film Law of Population from 1922 that shows both sides, particularly the need to restrict the births of the unfit. So can we roll Law of Population Part 1?
Screen card. Discussion of the question of population is not yet safe. Legal penalty threatens those who advocate the restriction of birth in place of the destruction of life. Yet society would be far better off if many beings were never born. What we want is a smaller population and a better population. Well-dressed man and woman sit at an office table. The man stands, picks up a candlestick telephone, and makes a call. They gather coats, hats, and walk outside and into an open-topped, upholstered motor car. A driver opens the car door. They travel into a neighborhood with rough-hewn fences. The man points to a large group of boys and girls playing outside in a yard. A building sign indicates Boys and Girls Aid Society. Screen card. This lesson must not let pass unheeded. Let anyone ask themselves whether it is more moral, more conscientious to give birth to children recklessly, carelessly, lustfully, in the midst of privation with no more regard for their future happiness than brute nature for its offspring, or to prevent such being born.
Thank you. The next film clip I'm going to show is centered on the need for well-off white women in eugenic marriages, two of the right kind of parents, or would-be parents, to reproduce. And this film will show the district attorney prosecuting a physician for providing his poor patients information on birth control. This is clip 1 from Where Are My Children?
Screen card, Chapter 6. Let us stop the slaughter of the unborn and save the lives of unwilling mothers. A courtroom. A lawyer holds a paper while standing in front of a jury. A bearded man sits in the witness chair. The lawyer interviews the witness. A white-haired judge taps his eyeglasses on an open book, makes a troubled face, and listens. The witness responds to a question. Screen card. My work among the poor often takes me to the slums. Image fades to a small tenement, roughly furnished. A woman leans over a baby in a small bed. Two young children sit around a table behind her. The woman's eyes are wide and worried. The bearded trial witness enters, holding a physician's bag. He removes his hat and examines the baby. Close-up of the infant in bed wrapped in blankets. The doctor straightens with a long look on his face. The woman rises unsteadily, weeping, and he tries to support her. She collapses, sinks down, sobbing. As the doctor prepares to leave, a second man enters, his coat torn. He speaks with the woman. His face twists with emotion, and he falls in grief onto the bed behind her. The doctor looks around the room, shakes his head, and leaves.
So I'm going to spoil the movie for you. The doctor will be sentenced to hard labor, I believe, in that one. And then there's another clip later on from the film in a dramatic climax to Where Are My Babies, where the district attorney learns that his own wife has had 4 abortions so that she and her wealthy, similarly child-free friends can continue to enjoy their garden parties and pampered dogs. And I'll just add that abortion as accessed by well-to-do women was a threat to the nation because these were the women who needed to reproduce. So let's have the second clip from Where Are My Children?
The lawyer, holding a book, enters his amply appointed high-ceilinged home, laying his hat down, then pausing near French doors. With one hand in his pocket, he slowly enters the wallpapered room, a grim scowl on his face. The house is filled with well-dressed women who are rattled by his presence. They turn in surprise and watch as he enters and walks slowly towards one shorter woman, his wife. He towers over her. She backs away from his grim stare. Screen card. I have just learned why so many of you have no children. I should bring you to trial for manslaughter, but I shall content myself with asking you to leave my house. He gestures to the door. The women turn toward the camera, their expressions uncertain and fearful. Most begin to leave the room, but one older woman confronts the man. We see out the front door as the fleeing, gloved, and hatted women stop briefly to comfort each other. Back in the parlor, the older woman speaks boldly to the man. Another woman looks on, holding a cape. The man opens his book and shows the older woman something. Her eyes bulge. And she turns and emphatically says something distressing to the younger woman, who stands unmoving, facing the camera, visibly upset. The older woman turns, moves brusquely with her friends, puts her cloak on, and both leave. Pausing at the front door, she gestures to a maid who brings her a stole as she holds a handkerchief over her mouth. An open motor car arrives. The pair enter, and the car leaves. In the parlor, the lawyer speaks directly to the remaining woman, his wife. Screen card, where are my children? She does not face him. She runs her hand through her hair, paces, and then throws herself down onto a stool. The man slams the large book down and turns his back. Turning to the woman again, he sits. A grave, aggrieved facial expression on his face, overcome.
So as you will see, what I call the material remnants of 20th century eugenics are everywhere, on films, on posters, in archives, in sermons from religious authorities of various denominations, and in the law books, including federal immigration restrictions, state and local segregation laws designed to prevent intermarriage, and state sterilization laws. Beginning in the 1890s, many states passed coercive sterilization laws aimed at so-called social defectives, including women deemed promiscuous, criminals, the insane, as they were called, and the so-called feeble-minded. Proponents, I think I went, let me see if I can go back. No, I guess we're still there. Proponents believe that sterilization controlled the costs of housing so-called undesirables in congregate institutions by making sure that they gave birth to no others like themselves. Its use increased in the opening decades of the 20th century. No one should be surprised to learn that women and members of minority groups were most likely to experience coerced sterilization. And although I'm focused today on the period that we like to call the progressive era, I want to note that sterilization took root across the globe, reached its apex in Nazi racial hygiene laws, and it continued in the United States. In 2002, the governor of North Carolina apologized for the state's role in sterilizing over 7,600 people from 1929 to 1974. More recently, in 2020, we have exposed cases of coerced sterilization, women held in immigration facilities. Now, in the United States, eugenics was anchored in a world of elite universities, research laboratories, legislative chambers. It had visible public spokespeople who were activists promoting eugenic-based programs steeped in the language of hereditary science. And again, I want to make clear it was not science, it was political speech couched in science. The outbreak of World War I would close the sea lanes from Europe and curtail immigration, but in the years that followed, eugenicists and nativists, deeply troubled by rising populations of immigrants from Southern Europe, Eastern Europe, often Catholic or Jewish, passed a number of laws to keep them out. The 1921 Quota Act, the 1924 Immigration Act. Let me see if I've got those up there. Oh, I'm going in the wrong direction. All right, there is our, this is just a quick view of two posters for movies, one both titled Race Suicide and Our Modern Women Cheaters, Racy Risky Sex is noted there. Oh, I'm going in the wrong direction again. This is some of the states. This is a map of the United States that points out legislation in each state that allows for sterilization. Laws in effect in January 1935, and states with pending legislation, including Texas, Missouri, Illinois, Pennsylvania, looks like, I can't read from here, looks like New Jersey, Delaware. I probably missed one. And of course, we had once welcomed workers in an urbanizing industrial nation, but now those same people were seen as uncivilized, dangerous, and breeding too quickly. Eugenics, I want to add, shaped the birth control movement, and Margaret Sanger, one of its leaders, embraced it as part of a Malthusian idea that the world population was out of control and that population growth among the poor needed to be halted. Now, people have been surprised to learn that Helen Keller was seen as a eugenicist, and this is, of course, debated how long she embraced it and how seriously. Her greatest emphasis was really on what we might call positive eugenics, promoting preventive health care, for instance, that would lead to the birth of healthy children, rather than on negative eugenics and a program of forced sterilization. But it is shocking to some people today, as it was then, her support of the euthanasia of a severely disabled baby with a physically and mentally compromised life, who Helen Keller and others saw as having no opportunity for an independent, productive life, and were imposing great costs for care on the family. The Bollinger baby case, as this was known, appeared in the, I'm doing it again. There's some eugenics, these got all mixed up. I don't know how that happened. I'm sorry. The Bollinger baby case appeared in the film The Black Stork, and there's a poster here showing a stork with a baby in a sling that it's carrying, and it says, "Black Stork, babies not treated." And it provoked, when the film came out, it provoked vigorous debate about the euthanasia of defective infants. Helen Keller weighed in publicly on the case and was not out of step with the intellectual leaders she considered her peers. But this was a one-time support for eugenics that we get from Helen Keller. So her view did reflect a widespread belief in eugenics as morally, politically, and intellectually a path to human betterment. Babies, future citizens, future mothers, future soldiers, were perceived of in the opening decades of the 20th century as playing an important role in public health debates as well as in eugenics programs. And this came in two sometimes competing separate spheres. One is that eugenics sphere, birthing the right kind of infants. The other is focused on saving the lives of infants and providing them with needed health services, a movement steeped in social welfare that saw environment and not heredity as the most powerful force shaping human development. Recall, well, you won't recall this, but know that in 1900, nearly 2 out of every 10 children died before reaching their 5th birthday, and poor children suffered a disproportionate number of those deaths. So, while it's too simple to say that the eugenics movement was led by men and that the movement to promote infant welfare and child health was led by women, It's not an entirely wrong statement. The United States Children's Bureau, created in 1912 when President Taft signed the legislation, created the first federal agency, the first national agency in the world charged with investigating and reporting on, quote, matters pertaining to the welfare of children and child life among all classes of our people. It was created thanks to women leaders before women were granted the right to vote. It was staffed by women physicians. They believed that the environments in which children lived shaped their future, and they created interventions to address family needs, such as visiting public health nurses in poor and immigrant neighborhoods. They were not unaware of the political milieu, so they always said that their goal was to teach poor immigrant families how to raise their infants, quote, the American way. Similar, I think, did I go past it here? Oh, there, I might have gone past. We'll go back there. Similar calls for patriotism led to federal funds for the 1918 Children's Year, a partnership between the United States Children's Bureau and the Women's Committee of the National Council of Defense. So in the midst of World War I, they set out to, as they say, save 100,000 babies. 11 million women participated in that effort. And on that, they built Baby Week campaigns. Now, part of the reason for this was that Woodrow Wilson, the president, was alarmed by the high rate of rejected draftees. And so he thought if we could raise healthier children from the start, we'd have healthier draftees in the future. The Children's Year was a multi-pronged effort. They gathered data on best practices regarding maternal and child health promotion. They documented the effects of poverty on health. They aimed to reduce the school dropout rate, to create safe spaces for children to play, and to address the particular needs of certain populations, such as orphans and delinquents. Thousands of communities across the nation participated, and in 1919, a White House conference on Children's Year synthesized it all into a series of concrete recommendations. But there was a lot of pushback from organized medicine. There was a lot of pushback from some religious communities who saw it as an intrusion into private family life. And so the stakeholders in this were forced to accept a series of compromises. And in doing so, I think they helped to enshrine the idea of means-tested, class-tested, fragmented approaches to child well-being in the United States that unfortunately persists to this day. I want to show you the work of the Children's Bureau in a clip, and it shows you how they included work with African American infants in a second clip. So we're going to have Children's Bureau clip 1, followed by Children's Bureau clip 2.
Screen card. Our country loses yearly 300,000 babies under 5. Half this number die needlessly. The Children's Bureau and Women's Committee of the Council of National Defense started Children's Year to prevent these deaths. Fine brick urban home. Children play in front. A woman holding a newspaper comes to the porch and shares the newspaper with a woman sitting on the porch feeding a baby with a bottle. The featured headline says, "Government wants children weighed and measured. Campaign on to reduce infant mortality." Baby kicks while women measure its length. Screen card. So women and mothers weighed and measured as best they knew.
Okay. And clip number 2. I know it's going to take a minute.
Screen. That is not the one I was expecting.
All right. Well, we'll take a minute.
Yeah, let's go on to the next one, the next clip. We cut that one. Screen card. The colored folk are equally enthusiastic over their conference. A room lined with benches is filled with a crowd of men and women and children. Long shot of a crowded clinic interior. Restless children with adults sit on long benches. Women bounce babies in long infant outfits on their knees. Other women smile at each other and their children and talk.
Thank you. And in the years after World War I, there were many programs of saving babies and family betterment on parallel tracks. One that you see up there is from the Better Babies show, where children are judged like livestock. And another one that we're going to see is the Fitter Families. You can see them in front of the eugenics building, where they're judged, frankly, by their eugenic potential. I'm going to give a description of this, and then we're going to roll a little bit of film. Quote, "At most contests, competitors submitted an abridged record of family traits. And at that point, a team of doctors performed psychological and physical exams on family members, and everybody would get a grade of eugenic health, and the family with the highest grade was awarded a silver trophy. And they were awarded in categories. So there was the small family category with 1 child, the medium family category with 2 to 4 children, and the large family size, 5 or more children. And anybody who got a B+ or better received bronze medals with the inscription, 'Yea, I have a goodly heritage.'" I think that no one will be surprised to know the winners were invariably white women with Western and Northern European heritage. I have a little modern film with sound that we're now going to show about the contests.
Today we judge chickens and cattle, but here's an interesting and disturbing fact you may not know. More than 80 years ago, here at the Indiana State Fair, we also judged babies. In this building on the southwest side of the fairgrounds where Hook's Drugstore Museum now sits. White Hoosier children, no other race was allowed, lined up and were judged on their mental development, their physical health and traits. Take a look at these photos from the Indiana State Archives. From 1920 to 1932, this was one of the most popular exhibits at the State Fair. An exhibit that supported eugenics, the idea of breeding better babies, an idea that today we know is racist. That's not, though, why these competitions ended in 1932. They came to a close due to the Great Depression and a lack of funding to keep them running.
I want to say that not all of the Better Babies contests, as apart from the Fitter Family contest, were totally focused on eugenics. And I know at least one contest in Marietta, Georgia in 1915 was sponsored by the Equal Suffrage Association, just to give people the message that if you let women have the vote, they won't be shirking their maternal duties. Now, the centering of babies as the bearers of political and social messages continues, of course, in many realms, in advertisements, and in baby beauty contests that were sometimes fundraisers. So, for example, the Washington, D.C. NAACP, National Association for the Advancement of Colored People, in 1925 had a baby contest with prizes going to babies whose supporters purchased the most coupons. And I do think it's going to show up here. Let's see if we can find that one. Is that it? I think that's it. That's a later one, but it's for 1946 contest from Baltimore. Showing mothers and babies sitting on the porch. Everybody looks very cute and happy. And they're wearing some wonderful, the kids have little caps on, and the women have beautiful hats on. During World War II, there would be baby beauty contests held. on military bases, and these were shown in a lot of newsreels. So to remind people, we're fighting for our nation's future and our children's future. So saving babies is going to live on long after infant death rates have fallen significantly. So let me pivot back to Helen Keller, and from Helen Keller, who had a flirtation with eugenics, to Helen Keller, the public health advocate. And at the center of both is, of course, healthy babies and saving babies. For much of the 19th century, the social movements led by moral reformers had focused on abolishing the sexual double standard, abolishing prostitution, and ending drunkenness, and we know how that worked out. But venereal disease was seen as particularly abhorrent and different from all other contagious diseases. Let's see if I can get there. All right, there's a eugenic. There's a picture of a man leaning over and speaking to a woman in one part of this image, and then there she is left behind with a baby in her arms and another little child there, and the man is clearly represented as having gone. Venereal disease was not directly addressed in public, although Edward Bach, the publisher of the Ladies' Home Journal, a very popular magazine for the middle classes, did address the subject in terms of preventing blindness, as did the Massachusetts Commission on the Blind, which had Helen Keller on its board. But the words syphilis and gonorrhea were never spoken aloud. Their transmission was not discussed. The words did not appear in print in the New York Times until 1917, when the federal government was forced to address the problem of infections in the wake of World War I. This is an image of a soldier leaning over a woman and baby saying, "Don't take a chance," and a disease card from Camp Lewis that lists the number of cases and the numbers of infected men. With this new but still limited openness, public health measures to prevent infant blindness would begin. Physicians and midwives were taught and sometimes required by public health licensing laws to use silver nitrate drops in newborn babies' eyes to prevent blindness. This was a method developed by a German obstetrician in 1880, slowly adopted in the United States in the early 20th century. So that silver nitrate prophylaxis became a standard. Oh, I've got 5 minutes, thank you. Helen Keller became an active supporter of this method of preventing blindness. She leveraged her role as a public health spokesperson to address a subject that had long gone unspoken. On the other hand, she placed her analysis of the problem, as did all the others, on a division between the innocent, infected newborn and the guilty, leaving unspoken how a venereal infection was brought home. She thus helped to keep both moral reform and public health and hygiene conversations alive. She supported the work of the National Society for the Prevention of Blindness, founded in 1908. Excuse me a moment, pushing for laws that required infant prophylaxis. This is a picture of a doctor administering the drops to a newborn baby and a woman holding a baby with sore eyes. If the eyelids are red and swollen and the eyes discharge, send for the doctor at once. In 1908, when the organization was founded, neonatal ophthalmia was responsible for 28% of blindness among students entering schools for the blind. By 1933, the rate had dropped to 11%, and it would continue to decline. Sadly, the problem persists. In the United States today, neonatal ophthalmia caused by gonorrhea is 0.3 per 1,000 live births. So it is a contemporary problem. The Children's Bureau began to educate midwives and to license them, and they were taught to use it. And this was a critical means of ensuring healthy births and the aftercare of babies in communities serving low-income families. So let's return to the question of what was silenced and what was done in the period from 1920 to 1925. And the answer is everything. Eugenics promoters found success in limiting immigration. Mass state sterilization procedures were stood up aimed at poor and minority and disabled individuals. And there was arguments that babies lacking a perceived quality of life should be euthanized. At the same time, environmentalists succeeded in expanding child welfare programs, engaged 11 million women in a campaign to save babies, and turned silence around venereal disease into an effort to combat blindness. Helen Keller stood at the center of these swirling social movements and brought both eugenics ideas at times and public health ideas more fundamentally to a public that had an ambivalent stance about where the future would take us. Thank you.